Okay, here's all the supplies for a catheter change. I have duplicates of the items just because I want to show you the front and the back of the packaging. The first catheter, actually, I don't know if it's always a foley, but this is a foley, and a foley is defined by this little balloon that holds it in the bladder. It's meant to be an indwelling catheter. You can see. So, this is my simulation. Now, if I was to do this in my bladder, that would probably hurt pretty damn bad. But if you're relaxed, none of this hurts at all. Hurts much, unless you've done something wrong. It doesn't need to hurt. You have to know what you just have to be patient. So you can see how this little valve here is where you fill it with water, sterile water, not with food coloring like I've done here. So I forgot to say that the absolute first thing you would do would be sanitize hands, put on gloves. But since I'm working with a plastic jar as a bladder instead of a human, I am going to be foregoing the gloves because it makes it easier for me to do this. Then you want to clean around the catheter site here, which would be on your stomach. Now, normally I would have a bandage around this. And then, so that would mean that I would want to use my peristoma cleanser and adhesive remover. Okay, so I will take my peristoma cleanser, just wipe around the area, just clean it off, make sure there's stuff. It's just really this is the dirty portion of the change, so you don't have to be too terribly methodical and careful. But the next step in changing the catheter would be we would put on some topical lidocaine all around, bunch on the tube all around, bunch of lidocaine. And then if we then we would be going, you can use standard lubricating jelly, that bigger tube there. But why, if you could have lidocaine and make it less traumatic for your body? Duh. So there's lidocaine. We apply it with our little cotton tipped applicators, and when we're doing this part, it's not as important that it's completely sterile, because this is the dirty part of the procedure. Generally, after my attendant has done that, my attendant will give it some time to kind of let it set, the lidocaine kind of start working, and then I will start sort of playing with my catheter. I don't do quite so much like this. I mean, I do a bit, because you want to see if it's where the balloon is right up against your bladder, against the wall. But mostly, not so much this, but more I do this. I spin it to dislodge it, in case a lot of times there's stuff that's encrusted to it, and so that kind of just dislodges it if you just kind of spin it a few times. And sometimes I push it out, not like I'm doing here, but just a little. And then once I think that it's really well lubed, feels like it's ready to come out, I'll start sort of pulling a bit and see. And then, so when I'm ready to start pulling the catheter out, when I think it's ready to go, I will have my attendant help me take out the water out of the balloon to deflate it. Really, when you push this luer lock syringe on here, it practically just pulls itself out, the water. We see as I pull, it's coming. Oh, deflating, 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 and deflating. then you do have to take this off. And now that that balloon is deflated, we're ready to pull it out. Generally, I have my attendant like brace on the sides around my catheter site so that I can, because I like to be the one to pull it out myself, because then I can control whether it hurts or not, and I can tell and I can listen to my body. So then I just start pulling and pulling. Sometimes it gets a little stuck, because there is a bit of a lip still, especially if it's a bad catheter like this one, which is why I'm sacrificing it. There you go, it comes right out. Occasionally, when you go to change the catheter, it doesn't necessarily let all of the water out. Occasionally, it gets stuck. Just now, I was trying to pull, and it just would not come more than, a little bit. And so, in that case, I just attach it, and then I try again. This balloon is the reason that if it's full, you can't pull it out of your bladder. It just stays there. It's not going to fall out. Even if it only has, at the moment, this only has like 5 cc's in it. And really, you're supposed to fill it with 10 cc's. And I do not recommend only using 5 cc's. But occasionally, when you pull it out, you'll get less than the 10 cc's. Especially if it's been like a long period of time or over a month, usually. Sometimes it won't fully, and trust me, the catheter wants to come out once there's no balloon. And even the balloon, once you have the syringe attached, really wants to deflate. It wants to pull that, it wants to come out. Like, I'm barely moving and it just came right out. It's much more difficult to push stuff in. So it really wants to come out. And so I'm going to show you what sometimes happens. Is that it can develop a ridge. You think you've gotten it all out, but it's just not coming out. There's like a ridge there. Well, obviously I'm showing coming out. Sometimes, especially on really shitty catheters, the balloon doesn't fully deflate and you have trouble pulling it out. And in that case, you don't have to just keep pulling. Unlike my dumbass occasionally, who doesn't think to just go back in and re-blow it up with water and then pull the water out again. It's not rocket science, but I mean, you can force it usually, because it's not really that big of a lip. But do you want to? No, that's a very bad idea. Don't force it. Just listen to your body, or the person whose body you're doing this with, and take it slow. It wants to come out. There is no balloon there now. It's not going to hurt anything if you have to put the water in there again and then take it out and put it in again. You might create some suction that could be uncomfortable, but otherwise you're really just not going to, it's okay. Don't stress. It will come out. These are Luer syringes, and you can see on mine, it's showing us, my catheter says it's a Lubricil Foley catheter, 16 French. And it also says, it should say, the balloon size too. Inflate with 10 mil. It doesn't say the balloon size is 5, but it says inflate with 10. And most catheters tell you that. so I'm going to pull out the last bit. Occasionally you can even come back and try to pull again a little more. As I said, it's okay to come back if it's like feeling like it's stuck or something. Sometimes even if it's encrusted. You can just come back and push it on. This Luer lock syringe on. You twist the syringe so that it's fully on there. You can pull. And if you do that, you generally won't get more. You know, you'll just pull and it won't really do anything. But sometimes you do get more. So it's always worth trying if it feels like it's stuck. But once we're fully certain that it's fully deflated and we're ready to go, pull it out. I pull it myself. Have my attendant stabilize my stomach, and we just get it out. Sometimes I like to also just look to see, was there any incrustation on this? You know, did it have that? Nope, it looks clean. Okay, well that's good. Good sign. We want to keep the dirty part of the procedure completely separate from the clean part of the procedure. So the little break that we had here in between pulling the catheter out and me starting filming the rest of this is, we're going to call it intentional, because you absolutely want to just get rid of everything, including even the towel drape. You want to get all, like, throw away the gloves that anyone's wearing, throw away everything. Like, take this drape. This drape's gone. Doesn't matter if there's nothing on it. Doesn't matter. Just get rid of all of it. You don't want to cross contaminate, you know, and that's always a risk. After you discard everything from the dirty part of the procedure, there's some things you'll want to do first before you start the clean part of the procedure. Some things to set up to make it easier. It's possible to do them not beforehand, but it makes your life easier if you do. So before I do anything, I am going to change out everything, switch my gloves, my sterile towel drape, and everything. Okay, there's a few things that we should prepare ahead of time before we start the clean part of the procedure to make life easier. Okay, so we will open this. We'll open the end that has this valve on the end, and we are going to first add the flip flow valve to the end of the catheter. If you do not use a flip flow valve, then you will definitely want to attach your catheter bag to the end of the catheter before you do it instead. But since we're using a flip flow valve, we don't have to worry. We can just use the valve. Just attach it onto the end here. I generally don't do this. It's my attendance. So pardon me if I struggle a little. But we got that on there, and we're making sure that it's closed. It is definitely closed because this is the direction the arrow's pointing. We don't want it open because, as I've said, if you just put a regular catheter in without this valve closed or without a catheter bag on there, and there's urine in your bladder, that urine is going to probably try to come out via the catheter. So yeah, that's not great. So we always attach this first, in my opinion. Then we also always pre-fill the balloon pre-fill the syringe to fill the balloon with the sterile water. Okay, I'm going to use my 10cc syringe to fill it up with 10 cc's of sterile water. Yes, this is not normally blue, but I'm doing this for demo purposes, so Don't worry, this isn't something I'm going to use for myself. Just get 10 mils of this. FYI, I just figured out that you might have to, if you're the one doing it and you're weak, you might want to, you have to pull it out one time first to get it unstuck. Be able to fill this syringe. Very good. Set that there. And I used to just pre-fill that. And then it occurred to us, hey, wait, we can attach this to the catheter before we even start the clean process. Because we don't want to have to fumble around once we already have it in, have the catheter in. So there we go. So generally we do that. So all these two things sticking out of it. And generally we discard the outside. Please don't be like me. Use a trash can. We leave my floor an absolute disaster when I deal with this. That's ready. That catheter's ready. We have it closed. And so now, let's see. So the next step, I generally have my attendants put on a new pair of gloves, not the sterile pair of gloves yet. We like to open the sterile gloves that we got and use that package Catheter because it's sterile as a sterile field to pour some of the lubricant in. So just go like this, open it up. We'll leave that there. There. Then we can put some lubrication in there. I've had to switch back to standard non-lidocaine lubrication if I want to do an aseptic change, because you can no longer get sterile lidocaine jelly as a consumer, individual consumer in the United States, because it's not covered by Medicare, prescription. So therefore, they just won't let you have it at all. So we did that. Set that aside. And then the next step would be, the next step is our cleaning around the catheter site. So we'll take some gauze with some hibiclens, or also known as chlorhexidine, Chloroscrub, or Prismantix. And just take this. So with the chlorhexidine, we wanted to make 3 separate different little wipes that we will use to clean around the catheter site. So it's really important that we never bring, so if this is the catheter stoma, the site where the catheter goes into my body or whoever's body, then you don't want to take bacteria that's dwelling out here and bring it over here. So you need to take it and you start at the very center, like right on top of the site, and you swirl in a circle and move outwards as you go. So going all the way out here. So you're not bringing it in. You discard that one. Do a second one. Same thing. Start right in the center. Very, very center. And then you swirl around. Out farther. And farther until there. And then the last one. Again, don't screw yourself up and go in. Go from the outside in. Start at the center and you're moving out. There. Now with chlorhexidine, you don't want to leave it on your skin. So I generally use the last piece of sterile gauze to just sort of make sure that there's not a ton left there. And then it's time to start doing the so I don't know if people need me to tell them how to put on sterile gloves, but I will do it anyway for you guys. So open it up, make sure not to touch anything, touch any of it. Now these are sterile gloves. So whatever's going to be your dominant hand, you do second. So if your dominant hand is your right hand, you do that second. So do your left hand first. So you pick it up. This is left. And you just stick. And you see how it's cuffed here? That's so you're grabbing on the inside of the glove. Just pull it on. Whoops. Don't touch the outside like I just did. I'm not used to doing this. And pretend they fit me. Then you know that your other hand's going to be your clean hand. So grab that with your clean hand, with your sterile finger, your sterile hand. Get your hand in there. So, I have the sterile gloves on. I don't want to touch anything if I don't have to. So I don't want to touch anything with my now sterile gloves. So I'm going to take my non-dominant hand and I'm going to grab the catheter here. And then, generally, we just shake it off, or I pull it off for my attendant. So they take their dominant hand with the catheter right above, a couple inches above where the balloon starts. And they rub it in this clean, sterile field of jelly, like that. And then they ask, okay, we ready? We push. Generally we feel one little pop, or one big pop, and then we'll feel another second pop generally. And then I'll tell them to stop when I feel like it's in all the way. And then my attendant just starts to fill the balloon. Okay, My attendant will take this clean catheter with their sterile hand and rub it around in this sterile field of jelly. Get some lube on there well. And then I have them put it in. And you just put it in. You have to push, otherwise it's not going to go in. And you kind of just feel your way and push it in. We usually feel and hear one pop, and then we'll hear a second. Most of the time we feel the second pop, but we don't always. So then I just kind of feel, and when it feels like it's in, like I feel it poking me, I tell them, okay, stop. And then my attendant is able to immediately start filling the catheter. And this might be why we do it. I have them do it. Come on, Phil. Bastard. Well, shit. Okay, and then once that's in there, I just have my attendant. Doesn't have to do anything. All they have to do, they don't have to run and grab the syringe or the sterile water or have forgotten it. They can just start filling. And generally what I like to do as they're filling is I start pulling so that I know that the catheter is like, the balloon's all the way in and it's like right up against the bladder, and just wait. I have my attendant while they're filling it tell me how much is left. Like right now there's 2, 0, 2, 1, 0 type thing. Milliliters. And if you don't immediately take so push that in. If you do not immediately take it off of here, the pressure of the balloon will try to deflate it and pull it back in. And so, see, it's already, I didn't even pull on it. It's trying to pull it out. So, don't worry if it tries to come out or, whatever. Just, you feel it in there, push it in, get it in there. Ha. There. And not every time will it, fight back, but sometimes it will. So, yank it off and done. Well, done with the hard part. Now, what we do is we generally go back in with some wipes and things that cleared up. I like to wear a bandage around my catheter side, just to keep any sort of tiny bit of discharge or anything, contained. So I take a bandage. Personally, I prefer the Optifoam Gentle, but Alevin works too. And I cut a slit in this. So, see, just about halfway. One slit to be able to make a split drain sponge to put around it. And so I just do that, and oh, yes, pull this side off first, but what I didn't cut, I like to make sure that the part that I didn't cut is on the bottom, like closest to my pubic area, because then it can catch any sort of anything if it comes out of that side. Then do one there, there. that's how I dress it. And generally, I also will tape the catheter in like 2 spots, like one up here and then a little farther along. I tape it with paper tape because it doesn't irritate the skin, and because I don't know about you, but does it seem like it'd be comfy having this thing going like all bouncing all around, moving around? No, it doesn't. It doesn't seem. It's not fun. As it seems, it's not fun. That's why I like to tape it up. And don't let the doctors fool you. When they first see if you tape it upwards, like toward your belly button instead of down. Sometimes, no, normally not doctors. Doctors don't really freak out. Don't really think about it. Don't really bitch about it. It's the dang nurses and CNAs and things like that think that they know everything, but they don't. And they're like, oh, but it's not going to drain. Yes, it's going to drain because of the laws of physics. Yeah, it's going to drain. Like, if it goes up, but it's going to then come down. So it doesn't matter. It's still going to drain. It's like not, it's just not a problem. Like, making it go upwards for like 2 inches and then down the rest, like it's not that big, like, no. Final note on supplies and things. Don't be like me, use a trash can. Have a trash can available. The floor always looks like this.
I'm not gonna throw the other bag away, just in case.
Yes. I agree with that idea.
God forbid, just in case.
Right.
We end up needing to abort the mission. But I am going to get your catheter cozy. And then did it work okay last time when we pre-attached it?
Oh, yeah.
Cool. I don't know if the camera can see here.
Yep.
That I already have the water loaded.
Yep.
And I already have the valve attached. And now I'm going to connect the bag
So good.
so that when we're ready to insert, it'll just be ready to go. Won't have to tug around. Especially the first time getting it on is always a little.
Cool.
All right, ready, Margaret?
Yeah, I think so.
Cool. So I'll go ahead and get the first towel drape on. And should I show things to the camera?
Yes, you can.
Adhesive remover?
Not it too much.
Okay.
I've already.
You've seen everything.
Yeah, those are the peristoma wipes I showed. I've already.
Sounds good. All right, we're going to get the adhesive off. You know if this is hurting at all.
Yeah. That's why we use paper tape.
Yep. Exactly.
I guess I didn't show my little pads that I made on my.
Oh, I can do a little pad shot here.
Yeah.
And it's this white bag that they go into for the laundry?
Yeah.
Okay.
God knows I've only made like several dozen, and we have like 4 currently.
Of the bags or of the...
No, of those freaking pads.
Oh, they're really cute.
They just get lost over the years.
That makes sense. All right. So, I will go ahead
Yep.
Clean off with some Hibiclens.
No, first we're gonna add lidocaine, remember?
You don't want to clean off before adding lidocaine?
Oh, do we normally?
Usually, but we can.
Oh, you're right.
We don't
Never
have
mind.
to.
Never mind, you're right.
Usually,
No, you're right.
I get everything cleaned before I
I forgot.
do anything catheter related.
I do not remember the full
Mm-hmm.
we've.
It's in really good shape today.
Well, that's good.
Yeah, it looks very healed from how it was last week.
That's good.
I'm just gonna go in with a wet wipe. Get the Hibiclens off.
Yeah.
All right. And then we'll do lidocaine.
That's the thing. We have so many redundancies built in to the freaking, process.
Mm-hmm.
But it's just good. It's good.
Yeah, I think about the lidocaine as the Hibiclens as just a transitional.
Yeah, no, it's a good idea. I probably I was the one that probably trained you with that.
You were.
I just didn't remember it in this moment.
All right, I'm gonna get ready to empty this.
Cool.
And I'm just gonna do one clean pull. Ready? Okay, I'm gonna do 2, 4, 6, 8, 9, and 10. And got about 9 milliliters out there.
Yeah.
Would you like me to empty into the...
Sure.
Just to see if there's anything wants to come out. Yeah, definitely a little wanting to drain.
Yeah.
I figure we might as well empty before we...
Poke around.
Yeah, before we
Yeah.
agitate the area.
Right. Plus that there's less chance that it'll go anywhere other than where we want.
Exactly. Still a little bit draining. Want to try? Sounds good. Go ahead and...
Right out.
Easy
Wow.
peasy.
Perfect. Good job.
Nice. Nice and smooth.
Good job. 10 out of 10.
Yay! I'm gonna do a little costume change here. We got a clean shot of it coming out too.
Good. Nice. This better not get freaking flagged. I'll freaking fight their freaking stuff.
Fight them.
You see? I'm using frickin' instead of being good.
Yeah, you are. All right, I'm gonna go ahead and clean with another round of Hibiclens.
Yeah, this is the important one.
Yeah.
Did we change out the straight?
I just remembered that. Thank you.
Good job.
Thank you. Mm-hmm. Got a fresh drape here.
very zen throughout this process generally.
You are. All right. So now we have hip cleanse. Okay, off. Yeah, there's no bleeding or anything at all happening today.
That's great.
So, and I'll do just another wet wipe. Just make sure that area is nice and clean. All right. So now it's time for the catheter.
So you get your sterile gloves and stuff?
Yeah. I'm gonna do a little lidocaine directly on the area first.
Oh god, you're so...
And then let that have a minute to activate. And then yes, now we will switch over to these sterile gloves here. Not me forgetting how to put gloves on.
Dude, same thing happened to me.
When you were
And
filming.
I tried to film myself doing it. So, you're not the only one. I was thinking that, but I wasn't going to say it because I didn't want to, you know. But dude, I totally, same thing.
Appreciate your solidarity, Margaret.
The worst part was they were ginormous on my hands.
All right. So, I'm just gonna drop the bag down here.
Yeah. No one cares where the bag is.
And then actually, I'll have you if you want to go ahead
Yeah,
and pull
do that.
this.
Yep.
All right.
And then your
And
clean hand.
With the magic clean hand. Just getting so much lube on this. Uh-oh, that's gonna get flagged.
Oh, Lord.
All right. Ready, Margaret?
Yep.
Cool.
Yep. You've got one pop.
And 2. Is that good, Margaret?
I think so.
That feels
Feels right.
pretty far. I'm
Yeah.
gonna hand you the tube now, and I'll
Oh, yes.
I'll go ahead and insert the water.
Yes.
Ready? All right, we have 10, 8, 6, 4, 2,
Let me pull.
and 0.
2.
Good?
Yep.
All right. I'll disconnect this now.
Perfect.
Feeling secure?
Yeah. Good job. 10 out of 10.
Yay! I didn't feel that second pop, but it's...
I didn't either, but it like felt like I could kind of feel it hitting the wall a little.
Yeah.
But like I wasn't sure if that was what it was or if it was the second leg or what it was. So I was just like, she's good.
Yeah.
But I'm glad that you've learned over the years how far we go.
Yeah.
Only a couple inches, right?
Yeah, it's not that much far after the first one, and
No.
I didn't want to cause any discomfort.
No, I kind of felt the second one. I think, it's hard to tell.
It depends on the angle.
Yep.
At some angles, you can really feel it,
Mm-hmm.
and at some, it just is glides in very gracefully.